Hello, hello, hello. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Thank you for joining me for another episode of Wellness Wednesdays. There we go. We are live for another episode of Wellness Wednesday. Thank you all so much for joining me. I am working to get everything set up for Instagram, which has been a challenge. So give me one moment. There we go. Welcome everyone to another episode of Wellness Wednesday with Dr. Wells. We are in the month of January and we're going to continue to discuss cervical cancer. Let me just give my disclaimers and credits. Again, I am Dr. Latoya Wells, family nurse practitioner, doctor of nursing practice, owner of Wells Legacy Health and Wellness. I want to say thank you all so much for joining me for another episode of Wellness Wednesday. I'm so excited to be here with you all tonight. We have some amazing things to discuss, some important things to discuss as it relates to your health. As you all know, each and every Wednesday, my goal is to come on here and provide you all with education, information that can help save your life, that can help you just make sure that you are on the right track when it comes to your health. And so tonight is no different. We will continue our discussion on cervical cancer. Last week, we discussed a little bit about cervical cancer in terms of what it is, some of the screening, just overview, right? Tonight, we're going to dig a little deeper into cervical cancer and what that means. Before we do that, I want to welcome all of our new viewers. We have had a lot of people follow the page and like the page. So hopefully they will catch, no, not hopefully, but I know they will catch this on the replay or catch us at some point during the live. So I'm so grateful for all of those of you who shared my social media message to invite your friends and those that you're connected with on Facebook to follow and like Wellness, Dr. Wells' page, Wells Legacy Health and Wellness, to like the page. So thank you all so much. If you have not done so, please do, not just on Facebook, but Instagram as well. So invite your followers, your friends to like and follow Wells Legacy Health and Wellness page. We are open for business, seeing patients. We're accepting new patients. Currently, we are accepting Medicare, and shortly we will have Medicaid on board. We're also waiting additional certification for other insurance companies. So once we're credentialed with those other insurance companies, we will definitely post that information for you all. But as of right now, we are accepting cash. We, as well as those individuals who have Medicare, we can provide services to that insurance company at the moment. We're located at 452 Osceola Street, Suite 106, Altamont Springs, Florida. Our phone number is 321-306-6755. You can find us on our website at wellslegacyhealth.com. So let's get with it. Cervical cancer. What is cervical cancer? So every woman who has a uterus has a cervix. And the very tip of the cervix is considered at the very tip of the uterus, the very bottom is the cervix. It's what dilates and opens up for the baby to come down the birth canal. And so if you guys can image, or if you can imagine a squash, like one of the big squashes, the one that's kind of top heavy, and then it gets skinnier and round and narrow towards the bottom. That's what I can compare to what a uterus looks like in its sense. Okay, just kind of give you some visual. At the very bottom of the uterus is the cervix. And cervical cancer is cancer that involves that part of the uterus, which is considered the cervix. So cervical cancer is a type of cancer that occurs in the cervix. As I mentioned, it's a part of the uterus or the womb that connects to the vagina. Most cervical cancers, as we mentioned last week, is caused by the human papilloma virus, which is known as HPV, which is considered to be a sexually transmitted infection. What happens when a woman is introduced to this virus? The cancer begins to develop, right? And when you have a pap smear, that's when they go in and take the speculum to kind of gain access to the cervix, hold it in place. And then there's a brush, and then there's a little scoop that they use to remove some of the cells, kind of scrape the cells off. They'll put that in a specialized solution, send it over to the lab, and they'll look at those cells. And so what happens is those cells begin to have abnormal changes. And it's picked up on the pap smear, which is why it's important to get your pap smears. And we'll talk a little bit more about who should be getting pap smears at what age and the frequency of that a little later. But so what happens is these cells begin to change, and there's different changes that occur. Okay. And then once they begin to see the early stages of those changes, if nothing is done, those cells will continue to replicate and become worse. And that's when we'll see the full-blown cervical cancer. There's different stages of cervical cancer, just like there are with several other types of cancers. But it's important to get your pap smear, women, to have your pap smear done and to be tested for HPV, because if left untreated, those precancerous cells can then turn into an invasive cervical cancer. So what are the symptoms of cervical cancer? Symptoms of cervical cancer include abnormal bleeding, pelvic pain, pain with intercourse, unusual vaginal discharge. However, now if it's in the earlier stages where there's mild changes in those cells, women may not notice any symptoms. They may not have any symptoms. Usually it's as the cancer progresses, those cells begin to change and replicate into more aggressive cells that you'll begin to see some of the signs and symptoms. I can't stress enough how important it is to have have your pap smear. Well, not annually. The guidelines have changed. I believe it's right now 3 to 5 years, depending on the situation. So we talked about the abnormal bleeding. So every woman who has a uterus and who is of childbearing age, we typically have or see that they have a menstrual period, right? There are certain situations when that doesn't occur. It's usually in pregnancy, a hysterectomy, if they have some type of disorder such as PCOS, which is polycystic ovary syndrome or disease, or they've had a hysterectomy, or some type of procedure such as a ablation within the lining of the uterus that stops the bleeding. So there's, under normal circumstances, women should have a menstrual period, right? And so usually it's a certain amount of days every month. The cycle is, between 21 to 28 days, depending on that woman. And they have the bleeding at that time every month or somewhere close to it. Anytime that there's bleeding in between your menstrual period or your cycle, that something is going on. And so with cervical cancer, you'll have that abnormal bleeding. There'll be some bleeding after sexual intercourse. And then there'll be postmenopausal bleeding. So the woman who has already gone through menopause, they're no longer able to have children. Those women should not have any bleeding. And so whenever we see bleeding in a postmenopausal woman, the first thing that we want to do is check for cervical cancer. Some of the other things that can occur with cervical cancer in terms of signs and symptoms: pelvic pain, persistent pelvic pain, pain in the pelvis and the lower abdomen. Now, there are some other conditions that could cause pain, pelvic pain in the woman. And so we always want to rule out cervical cancer as well as several other things. And we're not going to get into all of that tonight. But if you have any questions or concerns, or you need to be seen and have not had a pap smear, reach out to us. We can get you in and get you seen. Unusual vaginal discharge. So typically you have your period. Some women have a normal discharge, and that's just normal for some women, or all women to some degree. But whenever it changes in its consistency, if there's a different smell to it, if it's the color has changed. So whenever we're looking at abnormal or unusual, it's watery, bloody, or it may have a foul smell to it. Or if there are any menstrual changes. So if you have a woman who has their period every month around the 10th of the month or somewhere around there, and then all of a sudden it begins to change, or it's more frequent, then we look to see if there's something going on. So who needs to get screened for cervical cancer? As I mentioned earlier, every woman who has a uterus has a cervix, unless they've had some type of procedure. They have a cervix, and they should be receiving screenings for cervical cancer. The number one screening for cervical cancer is a pap smear. According to the United States, according to the American Cancer Society, it recommends that all individuals, all women who have a cervix, start getting a pap smear at the age of 21. It suggested that every 3 years for women between the ages of 21 and 29. So that initial pap smear should be done at the age of 21, and then thereafter every 3 years, as long as the results are normal. So another screening test that we can do, and you've heard me talk about that frequently last week and this week, is HPV testing, and it can be used in conjunction with the pap smear. So if you're getting your pap smear done, they're also going to be taking samples to send off to the lab to test for HPV. So, and that's typically women age 30 and older. The American Cancer Society suggests that women age 30 to 65 who have a pap smear every 3 years and HPV testing every 5 years. So it just depends. And it depends on the insurance company. Sometimes recommendations change, but as a rule of thumb, you start getting your pap smears at the age of 21. And then it will be every 3 years between the ages of 21 and 29. As women age, if they're between the ages of 30 and 50, the time frame on which they will get their pap smear can increase up to every 5 years. And again, if there's any signs and symptoms, anything out of the ordinary, we want you to get in and be seen by your primary care provider. Another way to prevent cervical cancer is becoming vaccinated against HPV. So the HPV vaccination is recommended for both male and female, starting between the ages of 11 or 12. And it can be given as early as the age of 9 years old. We spoke a little bit last week about the controversy in the beginning when this vaccine came on the scene in regards to should we vaccinate males and females, because initially it was targeted just for females. But then we began to see that the HPV virus is more likely coming from the male counterpart. And so it would be wise to vaccinate both to help prevent that. We talked about who should be getting cervical cancer screenings. We talked about the age of cervical cancer screening and how frequently that should be done. We talked about the signs and symptoms of cervical cancer screening. I want to stop for a moment and talk a little bit about the sexual history. So, who you've been sexually involved with, the number of partners you've had, high risk behaviors are all things that can place an individual at risk for cervical cancer and contracting HPV. So, sexual activity, the number of sexual partners can influence an individual's risk. Um, if there's a family history of certain types of cancers, it could definitely place an individual at risk for developing cervical cancer or any other type of cancer. And so it's important, again, that we get you in and get you screened and that you know your risk factors. So individuals who have a history of abnormal pap smears, individuals with a weakened immune system, or those who have had exposure to uh, certain conditions or certain chemicals are at risk for developing cervical cancer. And those individuals may have to have screening a little earlier or more frequently. What do you do if you are a woman that is having some of these symptoms? The first thing we want you to do is contact your primary care provider. If you have a gynecologist, that is great. Many primary care providers will and can perform a pap smear in their office. However, once things become abnormal, likely you'll be referred out to a women's health specialist, gynecologist, women's health nurse practitioner, what have you. Okay. And then you will get the additional screening testing that's necessary to figure out what's going on. What's the next step if you get a diagnosis of abnormal pap cells? You get your pap smear, it comes back that it's abnormal. There's different grades or different levels with the changes of those cells. And so if you get an abnormal result, don't panic. Reach out to your gynecologist, your women's health specialist, or your primary care provider and schedule an appointment, and they'll get you in and get you tested. But the most important thing is screening. Screening, screening, screening. Every woman that has a cervix, every woman that has a uterus has a cervix and should be getting this screening done. If you have questions, if you have concerns, if you are not sure what's going on, reach out. We're here to help you. If you have a primary care provider, reach out to them to get the care that you need, get your questions answered. It's so important that we get screened. Many times we are reactive versus being proactive as it pertains to our health care. And as a busy woman, a wife, a mother, I wear many hats. There are times where I forget, right? I forget to schedule that appointment. I forget to follow up on things because I have so much going on. I encourage you to make your health a priority. We're in 2024, it's a new year, right? And so start checking off all those recommended screenings and things that you need to get done. Put it on your calendar now. Call and make the appointment. If you don't have a primary care provider, reach out. We can help you. If you have questions about a result and you're not able to get the answer from your own healthcare provider, reach out. We can help. We can get you on a quick telemedicine visit or virtual visit, and we can answer those questions that you have. Men, those of the men that are watching, if you have, and I know that you have a mother, sister, nieces, cousins, female friends that are close to you, encourage them to get their pap smear done. Women, talk to your girlfriends, hold each other accountable, because at the end of the day, we don't want one more person to lose their life or be impacted by cervical cancer when it can be prevented. Some of the statistics on cervical cancer is that it's the fourth common cause of cancer globally in women. Another known fact is that if it's caught early, it can be treated and a life can be saved. So let's do our due diligence to make sure that we are following up on our health. We're keeping track of what we need to get done to take care of ourselves. Watch ourselves, watch your bodies, know your body, and pay attention. Focus in on your body. Get to know your body so well that if anything changes, you know it. I can't stress it enough. Screening, screening, screening. Do what we need to do what you need to take care of yourself. As women, we make appointments to get our hair done. We get our mani-pedis done. We make appointments for our families. We make date night appointments, right? There's so many things that we do to take care of others. It's time to be a little selfish and take care of yourself. And that means getting the recommended screenings that you should be getting to take care of you. Because if you are not well, you can't take care of your family members. You can't be there for them and not be 100% if you're sick or you're not feeling well. Some women, it's taboo to talk about things like this. And many young girls have not grown up in families where it's openly discussed. And so some feel a sense of shame when it comes to talking about personal things, such as things that deal with the vagina, the cervix, the uterus, the menstrual cycle. It's almost taboo. Let's have those conversations with our young ladies, our young girls. They need to know, they need to understand that what's happening to their bodies is natural. It's not nasty. It is a part of life. And it's something to, in a sense, celebrate, because they're moving from one level as a child into a young lady, a young adult. And when that occurs, when a young girl hits puberty and they have their period, it's a transition from one phase of life to another. And it's not something that should be shamed. They shouldn't be shamed about it. It's a part of life. And so let's have these conversations. Let's provide a safe space for our daughters, our nieces, our friends, our girlfriends to have these conversations. Just as we talk about everything else, add this to the list of things that you're going to talk about at your next girlfriend group, girlfriend setting, your next dinner with your next lunch with your friend, and make sure that we're holding each other accountable. I scheduled my pap smear. It is in 3 weeks. And so that's one thing that I was able to say, hey, I got that done, and I don't have to worry about it until the next time it's due. So one other thing that I wanted to talk about really quickly is it's important to follow with your GYN yearly, even though you're only getting a pap smear every 3 to 5 years, depending on your situation. It's still important to get that exam, to go in. They'll do a clinical breast exam. They'll ask you some questions. They can do a manual exam just to check and make sure everything's okay. But they won't always do a pap smear every year unless there's something going on. So make yourself a promise, write it down, put it in your calendar, put it in your phone, put it on a sticky note. I am going to schedule my pap smear this year, and I'm going to get it done sooner rather than later. We don't want you guys, I don't want any of you to be a statistic. We want to make sure we're taking care of ourselves. We're going to go ahead and end for tonight. Thank you all so much for watching. I truly enjoyed being here tonight with you for another episode of Wellness Wednesday with Dr. Wells. Be on the lookout for our page, social media, Facebook, Instagram. We do have a TikTok account. We're coming up on that as well. And these videos can be found on our YouTube page if you ever want to go back and review them later. This has been an amazing night with you all. I hope something that I said tonight stood out, resonated with you, and cause you to want to go ahead and schedule those appointments. As we continue this journey of discussing cervical cancer awareness, let's continue to lift up and to send positive vibes and prayers and positive words to those who are dealing with cervical cancer, because it's happening, it's impacting lives, and we want to make sure that we're supporting those. If you want more information, you can definitely go onto the American Cancer Society, or you can Google cervical cancer, and there's a wealth of information and knowledge out there for you. This is Dr. Latoya Wells with Wells Legacy Health and Wellness, where our mission is to ensure that our patients, our family, and our community have the information that they need to leave a legacy of good health. Take care, stay safe, and be well. Until next time, see you later.